All right, it is 19 minutes gone past 5, and you tuned into Smooth Health on Smooth 98.1, your love music, love life station. And today is Thursday, and on Smooth Health, we will be discussing understanding mental health. It is a thing, it's also to create awareness with regards to mental health. Some people don't even understand what it is. They have misconceptions about what mental health really is. They also sometimes confuse it for what mental illness is as well. But having this conversation with me is none other than Dr. Fagbo Oluwabusayo, and she is a mental health specialist. And I bid you welcome to Smooth Health, Dr. Busayo.
Hey, good evening, everyone. Good evening.
Great to have you in. And an interesting conversation we'll be having this evening. But first, before we even get into the nitty gritty of understanding what mental health is all about, I want you to even break it down for us. What exactly is mental health in itself?
All right, thank you. Okay, so mental health is a term that it is popular these days. However, I want to give a definition that is like the definition given by the World Health Organization.
Okay.
Okay, first, I'd like to define health itself.
Mm,
Health is the state of, World Health Organization defines health as the state of its complete physical, mental, and social well-being, not just the absence of diseases. That's to tell you that there is no health without mental health. So when you hear, oh, there's no health without, it means in the definition of health, physical, mental, and social. So mental is there. So now the definition of mental health by World Health Organization is it's a
mm-hmm.
state of mental well-being that enables people to cope with the stresses of life,
Okay.
realize their own abilities, learn well, work well, and contribute to their community. That's what mental health is all about. So
Okay.
let me break it down into lay language.
Great.
When you say somebody, when you say somebody is healthy mentally,
Yes.
it means this person is able to cope with stress because stress is a normal part of life.
Mm,
It's how you respond to it that will now
that
determine
matters.
if you're stable. You understand? So
Okay.
when you say somebody has a good mental, that means the person can cope with stresses of life. The person realizes their own abilities, what they can do. You
Okay.
understand? They can learn well, given a vocation or education. They can learn well.
Mm-hmm.
They can work well, and they can
Mm-hmm.
contribute to their community. Because as we go on, I'll be emphasizing things of functioning, because these are things that will make you know, oh, this person is not okay. You pick it
Mm,
first from their personal functioning, their
all right.
occupational functioning, and functioning within the family.
All
So that is
right.
mental health.
Thank you so much for breaking that down. At least now we know what it is and how not to mistake it for something else. But now let's even get down to the nitty gritty, which is how do we get to differentiate between mental health as well as differentiate between mental health and mental illness? Because there's usually this divide, or will I say this misunderstanding on how to group it or understand it better. So can you break it down for us?
All right, thank you. Okay, I guess I already started explaining that
Yes,
even
indeed.
without so mental illness has been called many names. You call it mental illness, mental disorders, mental
Mhm.
health condition.
Okay.
Now, I like to define first by by the accepted definition before I now explain it in the lay terms. So when you
Hmm.
say mental illness or mental disorder,
Mm.
still using the World Health Organization as the reference,
All
is
right.
characterized by a clinically significant disturbance in an
Okay.
individual's cognition.
Mm.
Cognition, when you think of cognition, think of memory, emotional
Mm.
regulation, and behavior,
All right.
and will result in distress or impairment in functioning. Like I explained, that functioning can be in their personal functioning. And when you're talking about personal functioning, you're talking about, is this person, can the person take care of himself,
Mm-hmm.
bathing regularly? Is this person eating well? Everything that has to do with your personal functions. Is this person sleeping well?
Mm-hmm.
When you're talking about the occupational function, you can start even from within the house chores. Can this person do the regular house chores? Oh,
All
this
right.
person is a student. Is this person going to school? Can this person cope in school? Okay,
Mm,
coming to the occupation of, okay, this person is employed at work. Is the
yeah.
person going to work? Can the person function when at work? Or
Mm-hmm.
there's just series of absenteeism,
All
not
right.
coming to work. Even when the person is there, is the person doing what the person is supposed to do as a result of this illness, mental illness?
Okay. That's a great understanding, and thank you for breaking that down because there's been some misunderstanding when it comes to trying to figure out what exactly mental illness is and how to, really define it in itself. But I appreciate you clarifying that. But how can one now tell the difference between when you're normally stressed out and when it's affecting your mental health or your mental stress?
Well, the truth is that you cannot talk about mental health and not mention stress.
Okay.
That's why when I was defining mental health, I told
Mm-hmm.
you the first
The
thing was that
stresses.
it's a state of mental health that enables one to cope with stress
Mm,
invariably. So what you're trying to do is that when one is stressed, it means that a level of stress can affect your mental health.
true.
Now, when do we say stress is normal? One thing you have to know is that we will all go through stress.
Mm-hmm.
Stress is a normal part of life, just like breathing in air. It is
All
how we
right.
respond to stress that matters.
Mm.
Stressful situations, take for instance, this is Lagos, right? You're just going and then you have a lot of, okay, now that there's no fuel, okay, so traffic issues are not so much. So dating back to when we have serious traffic, that's
Okay.
enough to stress.
That's enough stress
Now,
to on a
you
person.
understand? So now,
Yeah.
experiencing stress, can manifest in various ways for different people.
Okay.
People you can feel overwhelmed, some can feel so tense.
Mm-hmm.
These are from, I'm talking about stresses from external pressures.
All
The
right.
other ones from internal conflicts. You understand?
Mm.
But what I'm trying to explain now is that stress can present in different ways. You can even have physical symptoms like headache,
Okay.
fatigue,
Mm.
body pains from those
Mm-hmm.
stresses. You know.
True. True.
Now, because we're talking about mental health now, we are talking about the emotional responses that could happen when one is stressed.
Okay.
I put it to you, when you're stressed, you can be irritable.
Mm.
Usually, you're stressed, you take for instance, a woman that went to work and just got back from work tired, drove about 1 hour, and all that, and just get back to, and she's so tired, overwhelmed.
Yes.
Our toddler, mistakenly steps on her, and she just yells, and she's
Ooh.
just irritable. It doesn't mean she doesn't have, it doesn't mean she's
She doesn't
mentally
love
ill.
the child.
It
Okay.
doesn't mean she doesn't love the child. It's just
Mm.
as a result of that. That is normal.
Okay.
Now, your question is, how do you now differentiate from the normal stress and
Mm-hmm.
when somebody is mentally ill? If I get you, when
Yes.
somebody is mentally ill, like I explained, it will affect the person's functioning. The indicator that somebody is not okay, that is no longer normal. Because the truth is, whether or not there's stress or there's no stress,
Mm-hmm.
some individuals are more vulnerable to mental illness than others. Talking
Mm.
about factors that contribute to mental, yes,
Contribute to it. Mm.
yes, like a
Mm.
family history of mental illness.
Okay.
These
So
are things that are
that
like,
those are factors, right? That could.
yes, that can, and that, no, no, no. Now it's saying that, oh, this person's parent has mental illness. They are
Okay.
more vulnerable to mental illness. You're talking about the genetic predisposition here,
Okay.
which is different and varies from individual. And it doesn't mean that because you have a family history of it, you're going to come down with it. No. That's why we have other things that are called protective factors. That's having a good job, having a good family support, being employed, doing what you like. Those are protective
Okay.
factors.
Mm.
That, okay, they say, oh, my family, I have a family history, but it doesn't mean I'm going to come down with mental
With
illness.
it.
So let me not stray away or digress too much from the question. So now,
Because there are a lot of factors to actually look at when it
it's
comes
a
to
wide topic. It's a
it
wide
is
topic.
a wide topic
It is,
indeed.
it is, it is.
Mm.
So I just hope that I'll be able to answer some of the, generally problematic questions on mental health or mental illness. So to
All right.
separate normal stress from mental illness, usually the indicator is the functioning. That's where you notice it. When I speak to my patients and I'm talking to them and they don't want to agree to their illness, and then I'm like,
Mm-hmm.
you can't come and see me without your relative or somebody living with you. They look at me like,
Okay.
why? Because this is a brain issue.
All
Now,
right.
the brain has the responsibility of controlling every part of the body, right? It
Indeed.
controls the eye, sends signals to the leg to walk,
Mhm.
signals to the hand to write. You know, what when the brain has problem, who
Mhm.
sends signal to the brain? Now,
Mm.
the issue with mental illness is that some of the time, not
Yes.
all the time, it depends on the condition, because we have a
Of the
lot of
individual.
mental disorders.
Mhm.
Our patients don't know that they are behaving the way they are behaving. So I
Mm.
ask the patient, you're sitting down, please, can you tell me what is happening at your back? You can't. It is somebody that is around you that can know what's happening behind you. No one can see their own back facing front. You can't. You can't see what you, apart from you using a mirror, you don't know what your back looks like.
Indeed, you
You
can
don't know what it
tell.
looks like. You don't.
Mhm.
You have to use a mirror. So what I'm trying to say is that most of our patients, the symptoms, in fact, that's what brings them to the hospital, because mommy, daddy, sister, husband discovers that something is wrong.
Something is amiss.
This
Mm.
person has changed. Oh,
Okay.
she has not been. There are different symptoms. We have what we
Okay.
call positive symptoms,
Mhm.
negative symptoms. You know,
Indeed.
the positive symptoms are they're not as positive as they sound. There are symptoms whereby the patient begins to hear voices of people that they cannot see. They are seeing things they are seeing
The
things that
imagination
others
runs
are,
wild.
what you call what we call hallucination. Those are
Okay.
positive. Positive because patients, they do better. When patients have those kinds of things, they do better than the negative ones where the patient is not talking, is mute, the patient is keeping to self, doesn't
Mm.
want to socially withdrawn. Those ones,
All right.
those, and we don't really like them because the prognosis is, is not so good in patients that have
That mental.
negative symptoms. I get
Okay.
what, so what I'm saying in essence is that the difference is always you will pick it first from the functioning.
All right.
Personal functioning, like I explained, is the
Mhm.
person functioning at home. Sleep, for me, on my Instagram page, Mind Bob with Dr. Boosting. I call myself the sleep doctor because I'm not a professor yet, but with the
Okay.
little experience I have, sleep
Mhm.
is a major indicator. When somebody is,
Perfect.
beginning to break down,
All right.
person, every day I go to work, I hear my patient tell me I'm not sleeping well. That's always an indicator that something's about
That
to
something
happen.
is wrong. Mm.
So that's
All
where
right. Mm.
so those are one of the things from the functioning, that this is different from, normal stress, and then it becomes persistent,
Mm.
you
All
know,
right,
you know,
Doctor. All right, Dr. Busaya, we have a lot more to uncover and speak to because talking about family and the likes, I want you to mull over this, to think over this because it's something that I've heard a lot of is how do you get to deal with your family members who are struggling with their mental health. That we will, have a conversation about after this quick breather. Let's quickly take this quick breather on the other side. We definitely will be talking about that. Lagos, don't go nowhere. Stay tuned to Smooth 98.1. Health on the drive for the last 10 years. So it's a quick, very short, more like 7 minutes, or a minute rather. I said 7 minutes. A minute and we're back on air to talk about that. That's like you said, indeed, it is broad to talk about mental health. Really broad. The 10th edition of AMPCA is brought to you by Africa Magic in association with MultiChoice and Amstel Malta. This is Smooth Health on the Drive. This is Smooth Health on the Drive. All right, you're welcome to the second part of Smooth Health on Smooth 98.1. And today we are understanding what mental health is. And you can be a part of Smooth Health this evening and join in the discussion. If you have questions, you also can come through and ask away. I have my guest, Dr. Oluwabusayo Fagbo, and she is actually, giving us more insight into what mental health is and how you as well can, help those around you who are, suffering from mental health, or trying to understand their mental health. I know that before I went on that quick breather, I asked you, how can one actually, you know, you spoke about it earlier on, while we're having this conversation, like, oh, okay, so when your patients come through to you, you always ask them to come with their family members, owing to the fact that sometimes they might not know certain things are happening to them. So how can one who has such an individual in your family, how can those people in your family have conversations with them to make them understand what they're going through?
Thank you very much, Joy. All right, so this is one of such things that would help.
All right.
Now, when you have a family member, a relative, a friend, or somebody that's so close to you that is
Mm-hmm.
going through that is mentally ill, or has mental illness,
Yeah.
there are many ways by which you can support them. I'm going to be talking about how individuals can support, people that are close to them.
All right.
The first thing is these individuals have to be educated, and I really appreciate Smooth FM for doing this, because this is one of the avenue where people get educated.
Thank you.
We must keep talking about mental health awareness and advocacy every time.
Mm-hmm.
It can never be overflowed. So when you have people with mental illness, the first thing is to get education about it. And one thing I must tell you is that relatives are usually counseled. Every time you come to the hospital, you're counseled about the illness, the symptoms, what to expect, how you can support your patient.
Okay.
Depending on the mental illness, the first support is presence. What I mean by that is this: you have to come with them for their clinic follow-ups. That's if the patient is not, maybe probably the patient was admitted and has been discharged. What do we do at home? You have to come, because one of the issues that causes relapse, and because mental illness is a chronic illness, just like hypertension and diabetes, and it's always strange that when people hear, and we're going to still talk about the issues of stigma, okay? When people hear that people are using medications for mental illness, it's a problem for them when they get back home. Our patients, when they are with us in the hospitals and they're on admission, they function so well.
All right.
When they get discharged, then it's a problem, because they don't use their medications and all. The fear of stigma, many things. Now, what you can do is that, because what I found is that patients that have good family and social support, they do well. They do very, 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 very well. So, or even the burden of care is more on the relatives and families of our patients going through this illness. Okay. So you have to help them first, because most of them might be, most of them usually will. Some, I don't know what to use. I don't want to generalize. They might have lost their jobs due to this illness, because usually some of our illnesses are chronically relapsing. Patient keeps relapsing, going back, coming back. So they don't have jobs. So what does that mean? Money. They need money to buy drugs. Medications are expensive now. So how can families support them? You must support them with money. You don't give them the money. Buy the medications.
Get the medication.
Just get it for them. Now, it's not just about getting, because as I told you, it's the brain that has the issue. And you cannot tell when they started relapsing, because whether or not a patient uses medication, which is what the patient must do, a patient can still relapse. So that's why there are many things that encompasses mental health. Like I listed, there could be an intense psychosocial stress at that time. Are you getting what I'm saying? So the person
something could just have triggered that situation in their head, and they would relapse.
Yes. Like a loss of a loved one. And the person could not cope with normal grief and just enters a very bad grief, pathological grief and all. You know what I'm saying? Anything could happen, because you don't know what's going to happen the next minute. So so that's why they must help them in. If I tell some of my patients, especially when they are just discharged, you're going to help me serve these medications to this person. Okay. You're going to make sure this person is taking their medication. You're going to make sure they come for clinic follow-ups.
That is key.
Now, there's something we call high expressed emotions in psychiatry.
All right.
Emotional over-involvement, critical hostility. The truth is, when people have mental illness, their family members or people around them then feel that they're incapacitated. No, it's just like saying a person that has hypertension is not okay. Even though you check your blood pressure now, as
All right.
an hypertensive patient already diagnosed and it's normal, 170, you will still use your drug.
Indeed.
So it means that even though this person is doing well, is eating at home, doing everything, you must still use your medications, your mental, your drugs. You must help them with them. And will you tell a patient with hypertension not to sweep, not to, so sometimes at home they're so the relatives are so involved that they don't want them to do anything. Some make critical comments. Oh, she's mad. Oh, it has started. Oh, look at her head. Oh,
Wow.
these things. And researchers found out that no matter the amount of drugs that you use, patients that experience high expressed emotions, they might not do well even on medications. So those are the things that we must avoid. We must treat them like normal people because they are normal. They have a chronic illness that can be managed.
All right.
They have a chronic illness that can be managed. A lot of, and it's going to get to telling the community, the government, what they can do to help people going. People need to start coming out. Celebrities, doctors are like, nurses coming and say, oh, I have mental illness. These are my medications. This is going to help people suffer mental.
That indeed will help a great deal, because you know what? Let's even talk about the stigma, because it's one thing to say, oh, I'm on Medicaid, I have a mental health challenge, but coming out to even speak about it, some individuals can't come out and openly say this because they're afraid of the stigma. How do we now help such individuals? I know you said this is an avenue, that is through radio, giving information and creating more awareness. Aside this, what other channels can we help to stop this stigmatization against people who have mental health challenges?
Thank you very much, Joy. I think what we're going to there are different types of stigma. We have the self-stigma, we have the public stigma. Now, from what you are saying, I know that you want me to talk more on the public stigma, all of us. What can we do?
Indeed.
What can we do? The truth is that it starts with, if you're talking about it, first, because for somebody that doesn't understand what stigma is, it's talking about discrimination, prejudice, social exclusion directed towards individuals that are going through mental illness. That's what stigma is. Do you know that some of our patients, they need to hide that they have this illness just to get the clinic. Because once or they're already doing a particular job and they broke down mental illness, usually they're fired. And I tell people, it's nobody is nobody can be, you don't know what's going to happen to you. And that's why I'm going to follow from talking about the government. What can the government do? They must sponsor, all these things. If a person wants to sponsor educational campaigns, awareness, it's expensive. Government must begin to sponsor more awareness on TV, like general advert for food. It has to be more frequent. It has to be more frequent. It must stay in the minds of people. You know what advert does to the mind? You might not buy that at
that particular time, but it will keep
Indomie? Why is Indomie and Coca-Cola still advertising? Are we not eating it? They are putting it and registering in the mind of the people. So we must keep it. People underestimate the power of education and continuous, because it's an advert. So we must continue the awareness on what mental illness is, on how to identify that. Because mental illness it goes from the young to the old. We have mental illnesses in the old, like dementia. Some elderly people with dementia in villages have been stoned. If someone's telling me, have been stoned to death because they think they are witches. They say this person is confessing to this, confessing. No, the person is actually going through mental illness. I'm not saying they are not witches. Don't come for me. I'm not saying they're not village people. All right. But I'm just saying that of these things, by the time we sit down and speak to these people, we find out, this person has this symptom. And it's awareness, especially in the community. In the community, we need a lot of education. Other things that the government can do is policy. anti-stigma policy. We need these people to be included. Inclusive policies that will allow mentally people to feel like they're part of us.
Part of society as opposed to
Yeah,
being
yes.
secluded.
And these policies are not just around just health, to affect their housing, employment, and all. Talking about insurance, medical insurance, how, because most of them are paying through, the out-of-pocket thing. The out-of-pocket system is not helping.
So
Now you
so
have a
you're
patient
also
that is
saying
doing well.
insurance also should come through as well for mental health as well.
Yes, they should be giving preferential treatment.
All right.
So how much budget is the government willing to, add to mental health?
Right.
These are things that we need to look. It's about, the government is really going to do a lot. They can create job opportunities, vocations, that we have like a flexible working condition, considering their illness. Job coaching, a job that with accommodation to reduce stress, especially in places like Lagos. I understand what I'm saying.
I want to interject at this point. I know that you've spoken about the government, putting in their own efforts. How about individuals? What can corporate bodies as well do to, help support those who are having mental illnesses?
Okay, whether or not your family members, direct family has mental illness, get education about it.
All right.
Let's put it more on our social media.
All right.
Yes, we all must help in the advocacy on what we advocate on how to identify these symptoms. How to know that what are the symptoms of mental. It's there. It's online. You see, we're in a world of social media, a lot of things, we should use it for our advantage. It's everywhere. If you click on Google, click on all the chats, you will find things. So we should care about one another. You should look out for that person that is, changing at work. Don't just be critical. Don't just think that, she's because I don't know, because a lot of people have some myths about mental illness. And we have to understand that they're not pretending. They're not. We shouldn't wait until it's terrible before you believe them. Someone is telling you, your co-worker is telling you, I'm not sleeping, I've not slept in days. You should be able to, there's something, you have to check into the hospital. You have to go to the doctor. You have to let the doctor see you. You have to sleep. So we should help by watching out for one another. Like I said, education. Support. Support your friends with mental illness with funds.
All right.
Support them if you are, job creation. It's not just the government. Charity, non-governmental organizations. So these are ways by which, people can help, those that are having issues with mental health.
Thank you so much.
Stop the stigmatization too. Stop the stigmatization. They are just...
There's a whole lot to talk about.
It's a lot. Most times you don't find people born with mental illness. Usually it begins to manifest later in life. So it means that you are discriminating, you can still have mental illness. Yeah.
Sorry.
So empathy.
Empathy
very important.
Is key. All right. Thank you so much, Dr. Busayo. Trust me, I want us to keep talking and we could go on and on and on. But hey, you know how it is. Time is never our friend when we're having important as well as great conversations such as this. However, for those of our listeners who want to, further reach out to you and ask you further questions, how can they reach out to you on social media?
Oh, I'm popularly known as Dr. Boosting. And my Instagram handle is mindbulb. Mind like the mind, bulb like light. BULB. Mindbulb with Dr._Boosting. When you click mindbulb, it brings it up. Mindbulb. So that's one way you can reach out to us on social media. And we have what we call telepsychiatry. When you go to my bio, you click on the link and then it just takes you. And then you can always send a DM, a direct message on Instagram.
All right. Thank you so much.
And there's a number there. There's also a number there on the Instagram page.
All right. So I'm going to, put you on the spot. So when next we reach out to you, you'll be willing to come through and share more insight on mental health, right?
Definitely. Definitely. It's something I love to talk about.
Great.
It has become a passion and not more, no
Great.
more a job.
Oh,
Especially
I like
now that
that.
I love youth, and I've seen that the issue with substance abuse is
Abuse.
really a menace, and we all need to join hands in saving our future generation. Because
Indeed.
when you look at the age of the people that are abusing these hard drugs, these psychoactive substances, they are the strength of tomorrow.
Mm,
So this is something I'm so passionate about. On saving the youths
well
from
said. Well said.
from the demon called substance.
All
Yeah.
right. Thank you so much, Dr. Busayo. And I appreciate you coming through and shedding more light on mental health. But this is what we're cutting today. And Lagos, thank you as well for coming through and as well, giving us your listening ear. Smooth Health comes your way every Thursday. Until next week, Thursday, we'll be delving into another health topic. Well, don't go nowhere. Stay tuned to Smooth 98.1.